Today we're going to look at two bone density scans. The bone density scans are medically referred, so essentially your doctor has asked you to go and have these two scans done, and they are used to diagnose osteoporosis. The bone mineral density scan that we're undertaking today is really very important from the point of view of determining whether bone mineral density is A, normal, B, osteopenic or low, or whether in fact you actually do have osteoporosis. The early identification of osteoporosis is very important for your future bone health. Alright, the first scan we're going to do is that of the lumbar spine. So after this arm is placed into position, I'm going to get you to place your legs on top of this box for me. So raise those up for me. That's it. Okay, the scan's going to take 2.5 minutes, so keep nice and still. Before we start the bone density scan, you'll note that the patient on the table is dressed in light, comfortable clothing. There will be no metal in the field of view for the lumbar spine or the femur. If there is any body piercings, they are also removed because they can also influence the scan. The second scan we're going to do is just on the femoral neck. So that's where the femur actually joins into the hip, and this scan will take approximately 1 minute. If you've had a hip replacement on your left hip, the technician will do the right hip. If both hips have been replaced, the technician will do a forearm instead. There is always a way around so that at least we can get 2 pictures to send back to your doctor. The first scan that we're going to look at today is that of the femoral neck or the proximal femur. If we have a look at this picture here, bone mineral density is simply BMC or bone mineral content divided by the area over which the scan has been examined. We get a number in grams per centimetre squared, but more importantly we also look at the T-score. The T-score is the score that the radiologist uses to determine whether one has osteoporosis. A T-score of anywhere from +1 to -1 is described as normal. -1 to -2.5 is osteopenic, and below -2.5 is defined as having osteoporosis. The second scan I'd like to take you through is that of the lumbar spine. You can see here we have each vertebrae labelled as L1, L2, L3 and L4. Again, if we look at this chart, we have bone mineral density, which is again simply bone mineral content divided by area. We have a T-score that is labelled for each vertebrae, and we also get a total. As you've seen from today, the bone mineral density scans of the lumbar spine and proximal femur are simple, quick and easy to do. Our technicians here at MeasureUp, either in the city clinic or in one of our mobile vehicles, will do everything they can to look after you.